Hi, I'm Dr. Adonis, owner of Living Well Health and Fitness in Northfield, New Jersey. And I'm here to help you live well. Back pain is one of the most common injuries affecting people today. I'm going to show you 3 simple steps that can help you relieve your own back pain. This is Dana from my Living Stronger program here at Living Well CrossFit. We're going to go over the 3 steps, which are: 1 is to target which area of weakness that's causing your back pain, which is going to be done through a movement screening. 2, we're actually, after identifying that spot, we're going to show you some common areas that you can fix by yourself using rollers or balls or self-massage. And then 3, we're going to see if we actually fix that movement problem, because most of the time you have bad movement causes your symptoms like your back pain. All right, and then she's going to come up. Okay. A lot of times, what we're trying to look for is to see if our foot is moving out. That usually tells us if we're compensating or if we have a weakness. So she's going to do that again, if she can. And you see how that right side is moving out? That's telling us that the right side of her hip is a little weak, so she can't maintain that position. So what we're going to do is we're going to double check, and we're going to see if by holding her hands, if that will correct it. So hold your hands up. Try to squat. Okay, so her foot is still rotating out, so that means that the problem is in the low back versus the upper back. The second screening that we're going to do is we're going to have her do a toe touch. So she's going to move her feet together, and she's going to try to touch her toes with her fingers without bending her knees. Go ahead. Okay. And if you can go further than that, you can do so. So try to touch your palms down to the ground. Good. So now what she's going to do is she's going to bend one foot so the big toe is right by the arch of her foot, and she's going to try to touch the lead foot with her palms. Go ahead. And then she's going to come back up, and then the second area. Okay. Now, there's 2 indications. If she felt tighter or more so on one side than the other, that means that there's a problem more on the left than on the right, like a weakness. Okay? And then the last test, what we're going to do is we're going to have her face the wall. She's going to raise her hands over her head. And then what she's going to do is she's going to lean her head back and then try to reach for the back wall. And where do you feel it? Do you feel pain in the top, middle, or low back?
Probably low.
Low, okay. So she's feeling pain right here. You could also notice where when she's going back, let's do that one more time. She's moving mostly from here and not from her hips. And that's why she's losing her balance, because the hips should move forward and she should have range of motion here, okay? So that's one more indication that's letting us know that the problem's here, not anywhere else. So what we're going to do is we're going to relax these muscles and these muscles, so the outer and inner muscles. So then you're going to rotate all the way to the left. You can actually lean your elbow on the ground. And you'll notice when she's more on her side, she's hitting these outer back muscles. If she rotates a little bit this way, then she's hitting the inside paraspinal muscles. Okay, do you feel that?
Yeah.
Now, if you've been CrossFitting or working out for a while and you have a lot of muscle tissue there, we're going to use this, this is a little bit more intense. We're going to kick it up a couple notches. Feel that? Big difference. Now what she's going to do, she's going to lie on her back. And we call this dead bugs. So what she's going to do is she's going to raise both legs and arms straight up in the air. Okay? So what we're doing, the reason why we're doing this is because the fact that her arms and her legs are both up in air, all the stress is right here. So she's going to turn this on while keeping this up. Straight leg all the way down. slowly at 5 counts. So you can go 5, 4, 3, 2, 1, and raise you up at the same tempo. Okay? And let's do the other side, just as slow. 5, 4, 3, 2, 1, and come back up. It's really important that you maintain the tempo because this is called time under tension. The longer you take doing that rep, the stronger you get and you actually turn on these muscles. And also these muscles are used to keeping the contraction for long periods of time. Okay? We're going to use the same roller and you're going to sit on the roller. Okay? And what we're going to do is we're going to fold this leg over this knee and you're going to try to find that tender spot under your right butt cheek. So what she's going to do is she's going to just roll on that for 30 seconds or so. And this being her weak hip, that's where the overused muscle is going to be. Okay? We're going to switch out and we'll use this. And you'll notice, especially if we focus in on her face, big difference. Right?
Oh, yeah.
Yeah. So if you're just starting out, I would go to this, and then this is the big boy ball. All right? All right, so this heel is going to have to go right in front of the knee. It needs to be greater than 90 degrees. So you might want to get on this side, and this needs to be greater than 90 degrees. The angle that you have your shin with your hamstring, okay? All right, and then what she's going to do is she's going to try to hold this position, and because she's so amazing and strong, this is easy for her. So what we're going to do is we're going to have her hold her arms out on both sides. So that's a little bit easier for her because she's nice and strong. Let's hold it over her head. Okay. So let's start at your waist. Get ready to get a little jiggly. All right, raise this up. Yeah. So now you can start seeing how her muscles are trying to get used to it. Hold it overhead. So now you see how she's shaking a little bit? So she should be concentrating, squeezing that belly button to her spine. And then what she's going to do is she's going to try to hold it for 20 to 30 seconds. And then take a rest. And you're done. Good. Do these exercises 3 rounds, 2 times a day. It's not about getting you strong. It's about turning those muscles on. So it's just like practicing a new skill. We consider using your muscles like counting 1, 2, 3, 4, 5. If you count wrong, 1, 3, 5, only those muscles that you're using are getting worn out, and that's where your back pain comes from. So if we teach you how to move right and use a correct pattern of muscle firing, then you can immediately, instantaneously make yourself strong.